Hi, it's Clemmy from the NonHeme Clinic, and in this week's video I'm going to be talking about iron and inflammatory bowel disease. So if you're someone who experiences weakness and fatigue, or if you've been told you have an iron deficiency or iron deficiency anemia, then stay tuned because I'm going to talk all about what these things are and also what we can do about them. So first of all, most importantly, what is iron and why is it important? So iron is a mineral that has loads of different roles in our bodies. It's an essential component of hemoglobin, which is in red blood cells, and it transports oxygen around our bodies. It's important for energy, it's important for fat and blood sugar regulation, and it's also important for our immunity as well. And it also has many other roles, but they're just a few. So low iron or iron deficiency anemia can lead to feelings of tiredness, fatigue, weakness, dizziness, tingling in our legs, and also pale skin as well. Now we get iron from the food that we eat, and there are two different types of iron that we get from foods. So one is heme iron and the other one is non-heme iron. So heme iron, first of all, comes from animal sources, so things like meat, poultry, fish, eggs, and non-heme iron comes from plant sources, so green leafy vegetables, lentils, nuts, seeds, and dried fruit. So heme iron is more easily absorbed by our bodies. So if we have a meat-containing meal, on average about 25% of that heme iron will be absorbed, but this can actually increase to around 40% if we have iron deficiency, or can reduce to about 10% when our levels of iron are higher. On the other hand, the amount of non-heme iron that's absorbed from a meal can really depend on a number of different factors. So the amount of iron that we have in our bodies as an individual, but also other nutrients in that meal that may either aid the absorption or inhibit the absorption of that iron. And things that can aid the absorption of non-heme iron are vitamin C, but things that inhibit are things like tannin and phytates. But overall, about 5 to 15% of non-heme iron is absorbed from food, so less well absorbed than the heme iron sources. So how common is iron deficiency in inflammatory bowel disease? Statistics show us that iron deficiency is seen in up to about 70% of people with inflammatory bowel disease, and iron deficiency anemia is seen in about a third of people. So just to clarify the difference between the two, so iron deficiency is the decrease in the total content of iron in our body, and iron deficiency anemia is when that iron level is so low and low for a longer period of time that it actually reduces blood cell production. So iron deficiency occurs in people with inflammatory bowel disease for a number of reasons, and these include things like decreased iron intake from the food that we're eating, so decreasing the amount of iron-containing foods, difficulty absorbing iron in the small intestine, and this is more common in Crohn's disease that affects specific areas, so the duodenum is one of them where iron's absorbed, and also bleeding from inflammation of the lining of the intestine, and this is really common in the colon in ulcerative colitis, so blood loss happens and then you're more at risk of iron deficiency. So what can we do about it? So there are two ways that if you are diagnosed with iron deficiency or iron deficiency anemia, two ways that you might be treated for this. One is orally and one is intravenously. So pill or supplement forms or directly into the bloodstream. So orally, supplements are made up of iron salts. So iron sulfate, iron fumarate are two common ones. And these supplements are often given in higher doses, but actually our duodenum, which is the part of our small intestine, as I said, that absorbs the iron, can only absorb a maximum amount of about 10 to 20 milligrams of iron per day. And this actually means that most of the supplemented iron is not absorbed and then travels through our digestive system and out the other side, and it can actually have an impact on how we feel when we take iron supplements, and that's why people get feelings of cramps or nausea or diarrhea often when they take iron supplements. Studies have shown that taking iron orally can actually reduce 2 families of important bacteria that help to keep our digestive system healthy, and they're called lactobacillus and bifidobacterium. So they decrease those important bacteria that help to keep us healthy, and actually increase the abundance of a family of bacteria called enterobacteria, which can actually potentially be pro-inflammatory. And greater amounts of these bacteria have actually been found in people with inflammatory bowel disease. So the change in this bacterial makeup can lead to dysbiosis, increasing inflammation and diarrhea, and has the potential in some people to increase flare risk. So that's obviously something that we want to be avoiding. But iron supplementation is obviously very important if we find that there is a deficiency. So it's been suggested that high doses of oral iron should actually be avoided in people with inflammatory bowel disease because of the problems that I've just mentioned. And also anyone with IBD should be really careful when taking multivitamin supplements that have high doses of iron with them. So if you're someone who takes a multi, maybe have a look at that. Anyway, and to try and avoid these issues, iron can actually be taken on alternate days in single lower doses to help increase that absorption, but also reduce any side effects that you have. And on that front as well, there's a new oral iron medication called Ferrocru, and it's a type of iron called iron maltol, and that's actually now available on the NHS for treatment of iron deficiency anemia in patients with inflammatory bowel disease. And it seems to be much better tolerated with fewer side effects, and it's actually been compared in trials with IV iron, so injected iron, and it's been shown to have similar effects in increasing iron levels. So what can you do? 4 points here for you. One is to get tested. Iron deficiency screening is usually pretty routine in people with inflammatory bowel disease, but if you think you might have a deficiency and you haven't been tested for a while, then ask your GP or your gastroenterologist. The European Crohn's and Colitis Organisation guidelines actually suggest that patients who have been treated for iron deficiency anemia should be monitored every 3 months for the first year, and then every 6 to 12 months thereafter, just to check for a reoccurrence of that anemia. And it's really, really simple to get an iron level test, and that's something, as I said, simple blood test that can be done with your GP. So number 2 is treatment. So if you have iron deficiency or iron deficiency anemia, then you'll usually need treatment. And that might be, as I said, with oral or intravenous iron, but this should only be done under the supervision of a nutrition professional or your GP. And if you are taking oral iron supplements, then have a chat with your doctor or your gastroenterologist about Ferrocru, so the iron maltol, instead of normal iron salts if you are someone who's getting symptoms, because it may be more appropriate for you. Number 3 is be careful of supplements, as I've already alluded to. Because iron supplements might increase inflammation, we need to be really careful about that. So don't take iron supplements unless you know that you need them. And also have a look at your multivitamin. And if you can, opt for one without any iron in it. If you do take a multi, and then if you need to take iron separately, then do that separately rather than in the multi. But again, speak to a nutritionist or your healthcare provider before you take any supplements. And number 4 is eat iron-containing foods daily. So as I said, we get iron from the foods that we eat. And although if you have a deficiency, it might not be enough, but from a preventative measure and for ongoing, it's really important. So I mentioned the foods that we can get them in above, and before, you can get them in the blog that accompanies this video as well. Also what's really important is to, as I mentioned, when you're eating non-heme iron sources, so the ones that are less well absorbed, then pairing them with some foods that contain vitamin C can be really helpful and just help our body absorb them more effectively. I hope that was helpful, and I'll see you again soon.